Community health workers are so important. They are the liaison between the healthcare system and the community. We want to reach everyone.
Sometimes you run into people who might not seem to grasp, for lack of a better word, what's good for them. However, if you could just hit one person in the community and help change one life, that's great.
When we think about how community health workers can improve the health of residents, they are trusted members of the community. So they are actually members of a community that have experienced the same issues that their clients have. So they know firsthand what it is to face social and economic barriers. They also know where to find the resources. They know the organizations and the partners that they've utilized. So therefore, they know how to help their clients. So one way that we can definitely advance health equity is through our corporate-public partnerships. Our partnership with Humana is essential because it created a space and avenue for us to hire community health workers to do this work.
With the support of the Humana Foundation, we've been able to provide training to over 50 community health workers. So we've trained existing and new staff, and we have active community health worker initiatives in 18 states now.
The community health workers are going out into key neighborhoods where we know that we need to do work to increase health equity and access to care, engaging with both our Medicare and Medicaid members in those places. They're building relationships with communities, they're helping people to connect to the services that they need, and ultimately just helping us to build trust and bridge connection to the resources and the partners that can actually help our members get healthy and stay healthy.
The rural area surrounding New Orleans is very hard hit by Hurricane Ida, which occurred in 2021. And it's also, unfortunately, 49th in the nation in terms of health outcomes.
I've lived here all my life. I was born and raised here. Right now, the health situation, it's not too good. We have a lot of older people. Most of the younger people moved away, especially after the hurricane.
Region 3 is the river parishes and the bayou parishes. It's outside New Orleans, and it's kind of rural. Part of a region where we call Cancer Alley. You get a lot of chemical plants. Region 3 is number 1 in the state for colon cancer, number 4 in the country. And so what we're trying to do is we're knocking on doors and talking to people. We're going to community centers. We're going to parish governments, trying to get people screened for colon cancer and the importance of being screened.
Getting the word out is very important because that person can be saved. We have to fulfill our purpose.
If there was not a community health worker here in Houma, a lot of people would slip through the cracks and go without resources that are available to them. A lot of times when I introduce myself and I tell people, hey, I can help you apply for Medicaid, apply for food stamps, apply for housing, it's a relief to them because what we don't know is there's a lot of people in this area that can't read. I've been able to help them apply and get stuff done that they would have never gotten done.
Do you see that trailer back there?
Yeah.
I helped them get that FEMA camper right there. That was one of my first clients,
Health equity is important in New Orleans and all over the country. We know that in certain areas, based on your income, based on access, that everyone doesn't have equal access to services.
Research have shown us that only 20% of a person's health outcomes and life expectancy is determined by medical care and the access. 80% of a person's health outcomes and their life expectancy is determined by behavior, social, and economic issues. And with Humana providing this funding, they allowed us to focus on that 80%, to place people back in the community, to empower them, to help build self-efficacy, to build trust, to navigate them to resources, to try and reduce these health disparities that we're seeing in our lower income underserved areas. We're gonna see an overall improvement in health because people are going to be empowered and they're going to figure out how to manage their own chronic diseases. They're gonna figure out how to navigate to resources and find resources and utilize them on their own.